Arthritis, also known as joint pain, joint stiffness. Overview: arthritis is a common condition that affects joints and bones, especially the knees, elbows, wrists, and ankle. The symptoms of arthritis usually appear gradually or sometimes may appear suddenly. The signs and symptoms include joint pain and stiffness, swelling of the joints, decrease in range of motion of joints, or redness of the skin around the joint. There are different causes depending on the type of arthritis. The most common types are osteoarthritis and rheumatoid arthritis. Risk factors for arthritis include family history, old age, previous joint injury, obesity, smoking, etc. Key facts, usually seen in individuals older than 65 years of age. Body parts involved: hands and wrists, elbow joint, shoulders joint, hip joint, knee joint, ankles and feet. Specialists to consult: general physician, orthopedician, rheumatologist. Mimicking conditions: lupus, Lyme disease, gout, vasculitis, osteoarthritis, fibromyalgia. Necessary health tests/imaging, physical examination, laboratory tests, MRI, CT, arthroscopy. Treatment: NSAIDs, nonsteroidal anti-inflammatory drugs, ibuprofen, aspirin AMP, naproxen. Steroids: prednisolone, betamethasone AMP, dexamethasone. DMARDs, disease-modifying anti-rheumatic drugs, methotrexate, leflunomide AMP, hydroxychloroquine. Surgery: synovectomy AMP, joint replacement therapy. Physiotherapy. Causes of arthritis: osteoarthritis, rheumatoid arthritis, gout, juvenile idiopathic arthritis, ankylosing spondylitis, psoriatic arthritis, reactive arthritis, septic arthritis. Symptoms of arthritis: while it is difficult to know for sure if your joint pain is due to arthritis or not, based on the symptoms, there are certain signs that usually indicate you should consult a doctor. The 4 key signs include: pain. Pain from arthritis can be constant or it may come and go. It may occur when at rest or while moving. Pain may be in one part of the body or in many different parts. Swelling: some types of arthritis cause the skin over the affected joint to become red and swollen, feeling warm to the touch. Swelling that lasts for 3 days or longer or occurs more than 3 times a month should prompt a visit to the doctor. Stiffness: this is a classic arthritis symptom, especially when waking up in the morning or after sitting at a desk or riding in a car for a long time. Morning stiffness that lasts longer than an hour is a good reason to suspect arthritis. Difficulty in mobility: if you find it hard or painful to get up from your favorite chair, or after sitting in a single position for a long time, then it could be a warning sign of arthritis. Risk factors for arthritis: being overweight/obese exerts more stress on joints, particularly weight-bearing joints like the hips and knees. Trauma or injuries to joints. Habits of repetitive knee bending and squatting. Smoking puts you at more risk of developing rheumatoid arthritis. Bacterial and viral infections can infect joints and cause the development of some types of arthritis. Gender: women are more likely than men to develop rheumatoid arthritis, while most of the people who have gout, another type of arthritis, are men. Genetic and hereditary factor. Diagnosis of arthritis: physical examination. Based on the symptoms, your doctor will do a thorough examination of the joints for pain and swelling of the affected areas. Laboratory tests: fluids commonly analyzed include blood, urine, and joint fluid. Imaging tests: imaging scans such as X-ray, MRI, and CT scans are commonly used to assess the extent of damage to joints. Arthroscopy: this procedure involves inserting a small, flexible tube called an arthroscope through an incision near the joint. The arthroscope transmits images from inside the joint to a video screen. Treatment of arthritis: 1. Medications: NSAIDs, nonsteroidal anti-inflammatory drugs, are used to treat pain and inflammation and decrease joint damage. Some examples of drugs are ibuprofen, aspirin, and naproxen. Steroids are given to manage symptoms of arthritis, mainly pain and inflammation. These drugs also help in improving the range of motion by managing the symptoms. Steroids like prednisolone, betamethasone, and dexamethasone are used in inflammation. DMARDs, disease-modifying anti-rheumatic drugs, are used to reduce pain, swelling, and inflammation, especially in people suffering from rheumatoid arthritis. Commonly used conventional DMARDs include methotrexate, leflunomide, hydroxychloroquine, and sulfasalazine. 2. Surgery: synovectomy, i.e., removal of the damaged joint lining, is also recommended in case of severe inflammation of the synovial fluid that causes arthritis. Joint replacement therapy is a surgical procedure in which parts of an arthritic or damaged joint are removed and replaced with a metal, plastic, or ceramic device called a prosthesis. 3. Physiotherapy. Physiotherapy is recommended to keep joints supple and flexible. Exercise can help in strengthening the muscles around the affected joint and prevent further damage. Options include stretching exercises, exercises that provide a range of motion, low-impact aerobic exercises such as walking, cycling. Complications of arthritis, trouble sleeping, stiff and painful joints, makes it hard for you to sleep. Mobility issues. Arthritis can hamper the mobility of the person. Moving out of bed and working causes a lot of pain. Weight gain. Arthritis affects your ability to get around. Being less active can lead to weight gain. Anxiety and depression. It can lead to a toll on your mental health. When you're unable to walk around properly and remain in pain all the time. This can lead to both anxiety and depression. 8nine Healthify World. It's all about health, wealth and care. By Kunal Rao Rane.